As we hit our Omicron peak, new questions are emerging, like when should we lift the vaccine mandates and what kinds of variants can we expect?
Dr. Margaret Harris is an epidemiologist and community medicine specialist with the World Health Organization in Geneva, and she joins us now. Tēnā koe, Dr. Harris. Thank you for joining us. How does New Zealand's COVID response compare globally?
Good morning. Well, New Zealand has been one of the countries that has really managed a very, very good global response, particularly getting the testing, the tracing, tracking, and your vaccination rates have really caught up, and you've got more than 82% of people vaccinated. But like every country, facing particularly Omicron, which is a very, very transmissible, the most transmissible version of this, it's a challenge. And this is a struggle that countries around the world are continuing to face.
Yeah, at the moment, New Zealand is sitting at 95% double dose vaccinated. We achieved that largely, partly through mandates. Do you think, Dr. Harris, it's time for New Zealand to end its vaccination mandate system?
So we ideally would like to see that communities don't need to go to mandates, that they can understand that this is a benefit for all to be vaccinated. But sometimes countries have to make decisions that way in order to protect particularly their vulnerable populations. But ideally, it's something that comes best from individuals understanding that really this is a great gift from science that is keeping people both out of hospital and, more importantly, out of the cemetery.
In October, we dropped our elimination strategy. What did you make of that timing?
So countries, again, make their decisions based on their epidemiology and particularly on their vaccination rates and on how they see things. Now, for many countries, Omicron has really raced in and ripped through communities. But the critical thing is, have you been able to manage your hospital system? Have you been able to keep people out of hospital? Have you been able to really track it and trace it so you know what's going on?
What about our vaccine rollout? What do you make of that?
So I don't have the detail on your vaccine rollout, but the fact that you've managed to get your population vaccinated to that level is really good. But the crucial thing for every country, I'm not specifically saying New Zealand, is to make sure that the most vulnerable people, that's older people, people who have underlying illnesses, people who may be isolated, and also healthcare workers, you really need to try to get to 100% vaccination in those groups.
Absolutely. One of the criticisms, though, is that New Zealand was late to prioritise Māori and Pacifica, who are part of those vulnerable communities. What recommendations do you give to governments around the world in terms of prioritising Indigenous communities in their vaccination rollout plans or in their COVID response plans?
This is a really important point you raise, and many other countries have had the same sorts of issues in that they've had groups in society who are isolated either culturally, linguistically, or even sometimes geographically. There may be older people who simply can't get to where the vaccination is. So it is critical, and we have said this from the beginning, to look at who needs to be vaccinated first and how you're going to make sure you can get the vaccine to them. And really, really focus on that. The other thing that's critical is trust. You have groups within all societies that haven't necessarily got the trust in authorities that most of the population have. So you really have to look at, are there groups who aren't accessing the vaccines because there may be a lack of trust, and how can you overcome that?
Dr. Harris, I want to bring in here, globally, a minority are rejecting the science. How is the dis and misinformation impacting on the global response?
Certainly, we've seen a real misinformation. We call it an infodemic that has been almost as difficult to deal with as the actual epidemic created by the virus. Because again, if people are given wrong information, or again, they're given information that leads to mistrust, they don't take the actions that really protect their health. So, and I have to say, I thank you, everybody else in the media who has been working very hard to get the right information out. You've really been fantastic partners in this.
Omicron BA2 is becoming our dominant variant here in New Zealand. What will that mean for us?
Well, BA2 is highly transmissible, like BA1, but BA2 does seem to have an even greater advantage. So that means you have to be aware that you've got something that moves from person to person very, very quickly. So you have to do the things that prevent that. One of the critical things, of course, is mask wearing, especially when you're in an indoor space. Another really important thing is ventilation, making sure that you really can have the airflow. So the thing's in the air, but you don't want it to come into, you don't want to breathe it in.
Are vaccines, though, keeping up with the emerging variants?
The vaccines, yes. So far, they're doing what they were set out to do when the target product profiles were set. The aim of the vaccine was to keep people out of hospital and to keep them from dying. They're doing that very well. What they're not doing so well is preventing the transmission. And that's been one of the confusing things, because people thought, oh, if I'm vaccinated, I can't give it to somebody else. But you can. The critical thing, the reason to be vaccinated is to prevent you from getting severely ill and, of course, to prevent you from dying.
With the likelihood of a new variant emerging in the near or distant future, will we be expected to get a new vaccine every year, every time, just like the flu shot?
So this is a question that certainly our best minds in vaccinology and immunology are looking at right now. At the moment, and we've got a group that meets very regularly to look at this, at the moment, the vaccines we have are doing the job, but we do have second and third generation vaccines, some that will be given in the nose, just as drops perhaps, and they may be better at preventing transmission because they're working locally. There will be others with different delivery systems. So it's not clear whether it would be one shot a year or perhaps you take the shot if you see a rise in cases in your community, which may happen at any time of the year. It's not even clear that this virus will become seasonal. At the moment, it's raging all times of the year.
Dr. Anthony Fauci has said the world may be past the worst of the pandemic. Do you believe that?
He was talking from a part of the world that has seen its peak move, and we're seeing a small drop. We saw a 6% drop in cases in the last week, but we're also seeing a huge rise in East Asia and the Pacific. So, and I was looking at the countries that were recording the greatest number of cases in the last 24 hours, and they were from all parts of the globe. They were from Europe, Brazil, the USA, but also Asia Pacific. So we are still in the middle of a raging pandemic.
And how well do you believe that we are all prepared, but especially us here in New Zealand, prepared for any future pandemics?
If we take to heart the lessons we've learned, if we've understood that the science and the scientific community really, really led the way in an extraordinary way, not just by being brilliant and finding solutions, but working together so collaboratively. Now, other parts of the response weren't so good. In some parts of the world, politics really interfered with a good response. So if we could learn to use the science, use our hearts, work together, do the things that make sense, we will be much better when the next one comes, and it will come.
A recent report from Hugh suggests that the pandemic has increased anxiety and depression by 25% across the globe. What's your concerns there, and what can we do here in New Zealand to ensure that the mental health system is in fact prepared for, that sort of issue?
Certainly, it's really important that people have had a real dislocation for the last 2 years. They've seen big changes to their lives, to their work lives, their school lives. They've had this threat of an uncertain future ahead of them. I would say, yes, first of all, really bolster up your services, really ensure that people have an opportunity to deal with what issues are arising, make sure that you inject a little kindness also into your daily life. I would also say some hope. Even though it's been a horrible 2 years, we also have learned a great deal. We've achieved a great deal as humanity. And I truly believe that the best of us, what is the best in us, will continue to grow as we come out of this.
Thank you very much for your time this morning. We very much appreciate it. Dr. Margaret Harris there from the World Health Organization. Koe rā ngā take a Newshub Nation mo tēnei wiki. That's all from us for now. Thanks for watching.
Ngā mihi nui, and we will see you again next weekend.
This show was brought to you by the New Zealand On Air Public Interest